Thank you very much, and thanks a lot for having me. And I look forward to the conversations, that we'll have during the next 2 days. I think it's not bypassed anyone that the global health system is in crises. And actually, one of the things we talk less and less about is an architecture. We actually talk about an ecosystem. And an ecosystem is from the start something that is much more dynamic, something much more equitable, and allows many more voices than an architecture does. Because usually when it's an architecture, it tends to look like a Greek temple, not like a Frank Gehry museum or something. So I think, that's already a first indication. But this system is absolutely in crises. And I would postulate it's not only President Trump that has brought it into crises, because obviously it's a political and a financial crisis. Both of these, Trump left the WHO, he still has to stay a while until, it's according to all the rules. But the funding, of course, for global health, not only in low and middle income countries, has basically been destroyed. And some of you will have heard Bill Gates say that many millions are going to die as a consequence. So the system is being totally shaken up. In my view, the system should have reformed long ago. And so, as always, when there is a big crisis, as Nicola said, there is always an opportunity. And it's historic and it's serious. If we don't grab this opportunity now, I don't think there's many opportunities that are going to come over the next decades. We will need a deep structural reform of the system and the rules according to which it runs. We need to be much more committed to equity than we have been. And, I loved that picture of the sort of underground lines, because one of the most famous pictures on social determinants of health is the British Underground in London. And if you go from west to east, you lose 1 year of life expectancy at each stop. So, we have to visualize some of the things we are on about. But one of the key issues that we have to address is legitimacy. Because the system of global health has been run by US hegemony and US money. And therefore, who has the legitimacy to set the new agenda? Obviously, in the political sphere, it's also a North-South conflict to some extent, and based on the experiences, vaccine nationalism, and many other things during COVID, the developing countries, the global south, whatever term you wish to use, have clearly said, we're not going to continue like this anymore. And anybody who's followed the discussions on the pandemic agreement will know that the discussions have been incredibly tough, because the global south has said, you're not going to push us around anymore. I think a similar thing is to some extent happening in terms of non-governmental organizations, a whole range of voices that are actually, in some cases, in real desperation now. Think of HIV/AIDS patients in one of the African countries that are losing their funding. Think of patient and other organizations, even in the European Union, where the funding for non-governmental organizations is coming to an end, and the word advocacy seems to be a dirty word all of a sudden. So these are the kind of things that are happening, but also something very deep has happened during COVID, and that is that parts of society that used to trust each other no longer trust one another. So in many communities, people lost the trust in each other, I'm vaccinated, you're not kind of thing. But also people lost their trust in the healthcare system and in healthcare professionals. For a long time, whenever anybody asked, who do you trust in society? The politicians were down there and the doctors were up there. That's not that way anymore. And therefore, that's a challenge to the healthcare system, also in relation to what patients have been saying for a long time. You know, we can't just give you blind trust. We have got to be co-creators of the system. You have got to involve us in different ways. So we have these different power shifts, the geopolitical power shifts, the power shifts between different parts of the system, and the power shifts between different members, if I can call it that, in the global health community. And this is really important because a new power block has entered the global health community, and that is the tech industry. Now, many of you know, and here's the sponsor list. The partner list, I'm sorry, is that for a long time, the focus of, let's say, the evil person in global health has been the pharmaceutical industry. And if you watch what advocacy groups during the negotiations around the pandemic treaty, there was the vilification, basically. But hey, now we've got the tech brothers. And what we're seeing is that a new force has entered global health that can be, incredibly positive in so many ways of digital AI, etc. And much of that will be discussed over the next few days. But they basically are extracting the data of everyone here. Have the patients really been asked what will happen to their data? So I think there's a whole new agenda for patient organizations, for citizens, etc., to take up in relation to data extraction and in relation to data for the public good. In the project I work in, we've called that data solidarity. So I need to come to an end, I think, in terms of time. And I think what I've said, the spaces are closing down, the distrust of the system is going forward, the misinformation is increasing. So all of you are more important than ever. The system is, in a way, disbanding, and it is for civil society organizations, patient organizations, and here I must also say social justice movements and others to come together and reconstruct this system. The healthcare system is one of the most important systems in our society. It's a system that gives legitimacy to democracy, and I think we must fight for it.